All right, the time being 9 a.m. on Wednesday, August 17th, 2022. I'd like to call this Public Health Committee meeting to order. Clerk, please call the roll.
Lewis.
Sorry, warming my coffee up. Lewis here.
Shepro.
The lame duck is here.
Strathman.
Strathman here. Good morning.
Pepe.
Chappie here.
Wallace. Silva. Sanchez.
Sanchez present. Before I ask for approval of minutes, I'd just like to set us off with a little quote from John.
Request
Masefield.
unanimous consent to approve the minutes.
Before we get to that, I just wanted to mention one little quote, John Masefield. I must go down to the seas again, to the lonely sea and sky, and all I ask is a tall ship and a star to steer her by. I just been finding a lot of inspiration from that lately, so I wanted to share that with you. Mr. Shepro asked for unanimous consent to approve the minutes of July 20th, 2022. Any objection? Hearing none, the minutes are approved. Finance and budget, any questions for
Before we
Mr.
get to that, I
Snowden?
love your quotation, but I wonder if there is a particular relevance to.
It just, sometimes you just feel that you should say something at a certain time, and that was it.
Oh, okay. You're not suggesting we go down to the sea and ships.
I would love for us all to go down to the sea and get in a ship and sail around. That would be great. We're
Mace-
landlocked here.
John
so-
Masefield?
John Masefield. Yeah. It's a great one. Sea Fever.
Hmm.
That's the poem. Any questions for Mr. Snowden, who I don't even know if he's online, but typically don't have any finance and budget questions. Public comments. Mr. Shepard, would you like to deliver a public comment? All right, thank you. No one online that I can see. So we move on to animal control. Brett.
Good morning, everyone. All reports are on file. Just a couple quick things to cover before we do budget. Our next vaccine clinic, as we get rolling again here for the remainder of the year, is going to be Saturday, August 27th. It's about a week and a half. It's going to be on a Saturday from 10 a.m. to 1 p.m. We do have the largest dog wedding we're promoting coming October 2nd. It's going to be largestdogwedding.com, $25 per dog to register at Northwestern Field here in Kane County. We're hoping to get Kane County on the map in the Guinness Book of World Records, which would be fantastic for the world's largest dog wedding. The other thing that got reported yesterday and we'll continue to monitor is France had the first case of monkeypox transferred to a dog. It was two gentlemen that slept with their dog, so they believe the close contact. So they say, if you're positive, do not go near your animal. And that's what the CDC has right now.
Two gentlemen that slept with the dog in the
Slept
same
with the
bed
dog in the
them?
same bed.
Yes, okay. I
Yes.
just want that to be clear.
Yes,
Thank you.
thank you. Any questions?
Yeah, quick question. I was asked the other day, what is the average animal population at the shelter?
At our shelter?
Yeah,
I would say the average has to be about 12 animals. It would vary, dog, cat, other, but I would say on average 12 animals year round. We do go through our peak season. January, February, March are our three lowest seasons. Then we go right into kitten season that lasts us all the way through November. November, December, our numbers start to drop again. January, February, March are low numbers, which is our time to strip and clean the whole facility. Then we go right back into busy season, which is especially over the summer, and it correlates with winter and heavy snow. You're gonna have less animals running, to the warm summers and you have more animals out and about.
is there any trend up or down in surrenders or abandonments?
Surrenders are way up right now.
Mhm.
All rescue groups are full, all shelters are full, everyone, us included. It is just the COVID effects on the backside now the animal world's dealing with. And we're trying to do what we can to bring animals in just like every other facility around here. So everybody's doing the best they can, but everybody is full right now.
Thank you.
Any other questions for Brett and animal control? All right, thank you, Brett. Oh, I thought you raised your hand. I was like, oh, she has a question. I'll allow that. Next up. Oh yeah, Brett, do you have any presentation for your budget?
Yes, it's Blair, I'm sorry if you'd flip to that page. I
Still
apologize.
waking up. If it's not on the agenda, it's not in my brain right now.
There we are. So that is the budget for fiscal year 23 proposed. Our big changes in the revenue side is our charges for service. Resolution 22-08 was our increase to tag fees. This became effective January 1st. That is our driving force behind our revenues because again, about 99% of our revenue comes through those rabies tags that are sold to the public. That is how we earn our money in animal control. Then on the expense side, personnel, which was also resolution 22-08, which is where the starting salaries were increased. That was to start drawing people in. We had a very hard time there hiring anybody. For a little over a year or two of our positions sat empty. We just had to get more competitive with the local surrounding animal controls and other animal agencies. So by increasing tag fees, we were able to correlate that to the personnel fees to start getting people in. And we're very happy to say we're fully staffed and we've actually been fully staffed for 3 months now, which is a big deal for us. Especially when you only have 15 people in the whole entire department. Some of our other line items that have changed is a lot of fixing of previous line items. Things were put under the wrong line item. We've reassessed where certain items have gone. So we've done some jostling with the budget to fix that. So we do not have those issues anymore going forward. So that's where a lot of this came. And then of course, the transfer resolution is to IT, the 2428, and that's our reimbursement to IT. We may be taking another look at our revenue this year. When we did the revenue calculation for the tags, knowing about the personnel changes, we didn't know about IT at the time. And that has taken a hit. And if it keeps going up at this rate every year, it's going to put us into the red really fast here. So we may have to take a look at those numbers this year and see if there's something animal control can do. Because again, we're trying to balance keeping tags free to seniors, keeping some of the lowest tag fees of the collar counties, and continuing to offer the services we provide to the community at the same time. So we have to find that healthy balance to do that, because not only do we serve the people that own animals, we do serve people that don't own animals. They still call in with wildlife calls. They still call in with bites, complaints about animals, things they've seen. So we deal with everybody in the public, although it is the people that own animals that fund our departments. We just want to find that healthy balance to make sure we're still offering the services in this county. Again, those free tags to seniors, we're the only county in Illinois that does that. I would like to keep that. That's such a huge push and such a great thing to do for the community. Any questions?
Mr. Tepe?
Thank you. Brett, I noticed you have an income item of interest of $14,000.
Yes, and that comes through the finance department. They're the ones who do all those calculations.
That's
and
the
let us
interest
know.
that's allocated to you.
Yes, yes,
Okay.
yes. That's through the
Thank you.
money. We have,
Got it.
we have money sitting in reserve, the cash on hand. The reason for that is animal control does whatever it can to remain independent. So the county ordinance is 3 months of income. We keep over that just to protect against, if our air conditioner goes out, if our roof blows off, if a vehicle gets in an accident, if there's any other issue that comes up at the shelter, like last year, our water heater went out, one of our air conditioners went out, our garage door went out. We want to ensure independence from the county and make sure that we have those funds in reserve to be able to pay for those items should there be an emergency.
Any other, Mr. Shepro?
There's a county vet, is there not?
Yes, there is.
What are her duties? I mean, as I recall, the kind of person was available, but didn't do a lot unless there was a specific need for it. But I believe statutorily, we're required to have someone.
Correct. A licensed veterinarian, because I am a veterinarian. I'm just
Oh.
not licensed.
So
I-
are you the county
No,
vet?
I
Oh,
run operations. I track the operations side instead of the medical side because I love the operations of it. Our county veterinarian is Dr. Jane Davis. She is amazing. She's
She's
the
been
head of
there for quite a
a
while.
long time, and
Yes.
she's the head of biology at Aurora University. We could not have asked for a better county veterinarian here.
I remember when she was brought in, when I used to be the attorney for
Yeah.
and things were not so good over there.
She had a lot of nice things
Yeah.
to say about you, Mr. Shepherd. Yes, her duties, she comes in at least weekly to do all the medical exams on the animal. She is on call as we need her. She goes out to our cruelty cases. If there's a horse case, because she did track a lot into horse medicine and large animals, so she's phenomenal in that. She'll be out there in our cruelty cases. She'll come in and do extra work as we need. She's on call for our questions because she's the only one who can alter a rabies observation or the time frame thereof. So all those questions are then filtered to her to handle those sorts of situations.
Sometime, Mr. Chairman, maybe it would be interesting for the committee to have her come in and talk to us. I don't know that a lot of us have had any contact with her and this.
No, I sure
That
can.
says-
I know
yeah,
she would love to come
Is
speak to the committee.
that, I remember when we were a lot busier with bad stuff happening, that she was just really a wonderful lady, so.
Yes, I would love to bring her in. She's phenomenal. She's great to work with, and I know she would love to be here. So I will ask her.
Yeah, that'd be good.
Perfect.
Definitely.
Thank you.
Thank you.
Of course.
Any other questions on the animal control budget? Okay. Thank you
Thank
very
you.
much, Mr. Youngstead. And we'll move on to Health Department. Mr. Isaacson, you have an update and you're going to go over the budget.
I do. Thank you. Good morning, everyone. So we're very excited about how things are moving along. I mentioned last month at my first meeting that we were focusing a lot internally with staff. So we have made some promotions. Thank you to the board for voting to create a new position with grant funding that we were able to secure a doubling of our grant that we use to coordinate our early childhood network here in Kane County. So that's going to be a great service. We currently have 2 open positions where we're really focused, one in children's mental health and one in early childhood, where we're really focused on families and engaging families. So I think that's going to be something that's going to be, especially now. And as I talk about the Thrive by 25 idea here, especially important. And these jobs just posted, and we've been getting a tremendous number of excellent applications. So I feel really good about what's coming in and who we're going to be able to hire. So I'm very optimistic about that. I've talked at great length about the issues of mental health and substance use and trauma and the impact on our community. So I'm not going to get into all the statistics today. But one thing that I've been talking to people about for close to a year is this idea of putting together a 3-year plan that would bring together a lot of the different efforts in the community. So we have excellent things going around substance use. We have excellent things going around mental health. We have excellent things in our schools focused on trauma. But I think if we were able to put forward a plan and more of a unified county vision for how we all wanted to work together, I think that's going to be something that's very positive. So I've been talking to a lot of the people who run independent initiatives in the community and talking to them about how we could work together better and how we can galvanize not only the people involved in these efforts, but also to have a more united public message that's going out to people. So next week, you'll be getting an invitation to the kickoff event for the Thrive by 25. We're still looking at a couple of different dates. We have opted to do Zoom because we think we'll get better participation. I can't wait to get everybody back in a room together. But because we're trying to pull people from north, south, and all over, we feel that with Zoom, we're going to be able to get a lot more participation. So that invitation will come out next week, and I hope that you're all able to participate and join that effort. What we're going to do is we're going to work with people in the community for about 2 months to put together this unified plan and then roll it out. Thrive by 2025 or Thrive by 25 then is what we're going to look at implementing over the next 3 years. So even though we feel that we're past the worst of the pandemic, as we've all seen, there's still a lot that we need to do to support families and support people here in Kane County. People are still struggling, recovering from loss that they've experienced, still struggling with shakeups in employment and trying to deal with family members who've been sick and how things have changed for them. So I think this is going to be very exciting, and there's a lot that I think we're going to be able to bring resources into the community to really help with this. And I'll just make a quick note. We've touched on the gun violence work that we've been doing in the city of Aurora. So this is something through the Reimagine Public Safety Act at the state of Illinois. They're going to be pushing out about $100 million this year to prevent gun violence. So we have been working with partners in the city of Aurora. That's the location in Kane County that was designated to be eligible for funding. So we're working with community organizations, grassroots organizations. We've been doing this since about March, and the funding just what they call the NOFO, the Notice of Funding Opportunity, just came out last week with the first round of grant applications due in September, mid-September, September 15th. So there's going to be a lot more we're going to be sharing about that as well. It's focused on gun violence, but it also really includes addressing trauma, street outreach, making sure there's good mentorship programs, making sure we're supporting youth and families in the community. So I think a lot of positive things are going to come from that as well. So any questions about the Thrive by 25 idea? Otherwise, I think when you see the kickoff, it'll make sense what we're trying to accomplish. All right, very good. Thank you.
And do you have a budget presentation?
I do. Yeah.
Yeah.
Do it now.
Yeah, let's just
Knock it
continue
out.
on. Yeah.
Perfect. All right, thank you. All right, thank you, Blair. So here is a look at our revenue over the past 5 years. So you'll notice, obviously, property tax is flat. Permits have been relatively flat. We have seen some increases in grants with COVID. Certainly with the state, there was a lot of money that came through the federal government and was passed on to us through the state. The green is other, which of course includes CARES Act money, ARPA funding that was transfers over to the health department. But you can see now after COVID, our revenue is starting to drop back down again a little bit to pre-COVID levels. Looking at the different sources of revenue, again, property taxes is flat. Permits, we're projecting a slight increase. Our grants, mostly because we're seeing the reductions in the COVID funding are going down pretty substantially. So we do have some of our other grants that we're working on that we're seeing increases or getting new grants. But some of those larger grants that we had received over the last couple of years are going away. Fees are pretty flat, reimbursements pretty flat. And then transfers in, obviously a big change because we're not getting that, projecting that CARES Act money that we had received. Looking at this, it's a little bit harder to see on this particular slide, but looking at how our expenditures are lined up. So our head count, we're projecting to keep level. We are seeing with the union wages, and this chart, we were instructed by finance to include what we've negotiated with the union. So this does include the union increases. This does not include any increases for non-union staff. So at finance's direction, we were told to wait on that, but that is something that we would be looking for, hopefully to retain staff to be able to do that. But you can see contractual is where we're seeing the biggest reduction. And again, most of that is coming through a reduction in the funding that was allocated from COVID. Any questions? Yes, sir.
Contract tracing. Did you
Yes.
found that to work very well?
Contact tracing, it's kind of a loaded question. Did it work very well?
That's why I gave it to you.
Yeah, contact tracing is really important. And so if I was called and I was told that I had COVID and I'd been hanging out with you and I was able to call you and tell you that so you could take protective action not to spread it to your family, then that's very helpful. Are there some people who don't call back? Certainly. Are there some people who don't cooperate? Certainly.
Oh, really?
But yeah, it's hard to believe. I know. But for many, many people, contact tracing, and not just for COVID, but for many public health issues that we deal with, letting people know when they've been exposed, and you'll get an update on monkeypox here in a few minutes. That's one of our most effective tools.
I recall that early on, the McHenry County had a very low cooperation rate on the contact tracing.
Right.
And presumably that affects the
Absolutely.
usefulness of the,
Absolutely. And we all know, we've talked about it a lot. COVID has been a very interesting thing. So it's not even like regular contact tracing that we would do for an infectious disease, but it's people's perception of it, the way people were willing to share or not willing to share changed throughout the pandemic. So some communities definitely had better compliance than others. And we've seen that kind of wax and wane over time as well.
I'd say overall though, Kane County, we've had a pretty good response rate.
Yeah, people
Sometimes
have,
very, very high response rate.
yeah, people have been very cooperative, I would say, definitely. But there's certainly pockets of people who don't cooperate. But most people, and again, every case where somebody is cooperating, and again, I'm not trying to be dramatic, you're potentially saving someone's life because they know, I'm not going to go to grandma's house this weekend. I better just stay home. So it is really important to get that information to people so they can make the right decisions.
Is contract tracing something that's been brought in-house now?
We're still utilizing a call center right now. So we're still getting quite a few calls every day and have quite a few outgoing calls. But Ms. Onwuda will be able to give more of an update during her COVID presentation.
But I'm looking at it from an economic basis, not so much an operational basis. So
Not right now. With the current headcount we have, it would be pretty overwhelming for us to try to keep
that's
up
fine.
with it,
Got it.
because we're still getting a couple hundred COVID cases every single day. So there's still a lot of COVID out there.
And we authorized earlier this year, I think almost about $4 million for contact tracing. And I don't know the exact figure off the top of my head, but it's pretty low how much we've spent out of that 4 million. So yeah, we'll get to that when Uche's up.
Any other questions on the expenditures here?
the transfers in on the revenue summary on the last line, that line item is almost exclusively COVID related, which is why it's dropped to
Correct, exactly.
5%.
Yep. And that was CARES or ARPA funding, correct?
And there is a project in the works right now that we're going through, so that number will go
Yes.
back up significantly.
Yeah, so we were instructed to only include things that were already
That
done
we
and
know,
approved at this
yeah.
point, right? I'll look at our org chart. She should have a copy of. So I'm about 45 days in. I'm still looking at this and we may make some changes as we move forward. But here's how it is currently. So quick summary, of course, the health department is a special revenue fund. Every year we run a balanced budget. We're constantly looking for new funding, and I think we've been quite successful at bringing in outside funding. As I mentioned, when talking about the Thrive by 25 area, even though we believe that the absolute worst of the pandemic is over, the impact on the people who live in our community and certainly around the country is going to continue for several years. So there's a lot of traditional public health interventions that we're going to need to continue doing and actually to even ramp up to support our families. You can see that the essential services of public health and our mandates, we are able to meet them with the budget that we're proposing here today. And then also that our continuous improvement opportunities so that we can be ready for the next thing, which, for example, monkeypox, that we are able to meet those needs. So happy to answer any questions. Otherwise, it's pretty straightforward.
Any questions for Executive Director Isaacson?
Deputy here.
Stephanie?
Can we go back to the organization chart for a
Yes, sir.
moment? Although it's very hard to see, but I noticed on the organization chart that there are several vacant positions there. Have they all been budgeted for?
Yes.
Okay, so they're in the budget for this year based upon it. Are there significant problems in getting people to fill some of those vacancies because of the salary structure that we have?
Yes, we still struggle. So as I mentioned, we're having good luck with our two family-oriented positions that we have posted. But with our environmental health positions and our nursing positions, we're still struggling to fill those. And we believe salary is one of the largest drivers of that.
Was anything being done to change the offering?
We don't have a fully ratified contract, but the union has voted to ratify the contract. It will next come through the county board. We hope that that will help a bit. We did look at a salary study across other health departments. So we've raised salaries a bit. Again, that's for the union employees. So we've made some progress, maybe not as competitive as we could be, but I think we've made some progress. And then it's still open-ended for our non-union staff. I think there's more we can do to make sure that we're recruiting and retaining the right people.
And that will be something that we'll be focusing on in this next year. Mhm.
I don't want to put you on the spot, but
No,
any
sure.
kind of wild estimate of how much more money you would need in order to be competitive?
I think it varies by position, and we've had discussion about how other departments within the county are impacted by the same
Oh,
thing
yeah,
as well.
we
So
know.
yeah, trying to find what's a common solution that we can look at, and even looking at job classifications across even different departments to see what makes the most sense. So I don't have a solid comparison.
Again, I
for
don't want to put you on-
non-union.
Any other
We're
questions?
waiting,
Oh,
we're waiting to hear what the county will allocate to us. As I mentioned, it's not budgeted for any non-union increases. So that's something that's applied across the entire county. So it's not even up to a department head to determine if I had an extra X percent. It's more of a county-wide decision.
I know. Just trying to highlight it.
Thank you.
Any other questions before we move on? Okay, thank you, Mr. Isaacson.
Thank you.
Ms. Onwuta, you're up with our COVID-19 update and welcome back.
Thank you. Good morning, everyone. Can you hear me?
Yes.
Okay, so this is my usual slide looking at where we were in June, exactly 1 month, 2 months ago, and where we are now. Total cases per 100,000, 2.6, slightly lower than where we were in June. But looking at hospital admissions per 100,000, that increased to 13 from 10.6, as well as percent of staff inpatient beds in use by COVID-19 patients. That's expected because, it looks like we're kind of trending down with the number of cases, but then because of the surge we had before, hospital admissions start inching up, as well as inpatient beds occupied by patients. Those take a while to come down. So we're still at high community level. And so far we have had 148,000 cases and about 1,151 deaths.
Before you leave that slide, can I want to point out that there are still 15 more people that have passed away in the past few months, right? So we're still losing people to COVID.
Absolutely.
And I wanted to get your opinion on what what do you think is going to happen now that the schools have opened without masking mandates? Do you, what kind of an impact do you think that's going to have?
Could I hold off on answering that? I have a few slides that will address that.
Let's let her finish her presentation, then we can go to
Yes.
questions.
Sorry.
No, it's okay. Okay, so CDC recommendations for high community level. Most importantly is staying up to date on vaccination. They recommend wearing a mask when you're indoors, maintaining ventilation improvements, especially in schools, avoiding contact with people who have suspected or confirmed COVID-19, isolation when you're suspected or confirmed of being infected with COVID-19, and then following recommendations for those who are exposed to someone with COVID, which is wear masks for 10 days. Those who are at high risk of getting very sick are asked to speak to their healthcare provider about additional preventive action. And for those who are still at high risk of getting very sick, considering non-essential indoor, avoiding non-essential indoor activities in public where they might be exposed. So CDC modified guidance for COVID-19 last Friday. What they considered was right now, many people are using home tests, antigen tests at home. We really don't have a good grasp of all the people who are infected with COVID. But vaccination, we have a higher percentage of those who are vaccinated, and there's treatment for COVID and testing. The fact that the federal government has distributed home test kits. There are several places where you can do PCR tests. So we have these three things. So considering that we have that, severe illness, hospitalization, and death have kind of reduced because of that. So putting all of that into consideration, so the recommendation is for people to know their risk. Are you advanced in age? What's your disability status? Do you have underlying medical conditions? And then, protect yourself by getting vaccinated. If you're sick with COVID, there are treatments for COVID. And taking action personally, if you've been exposed, make sure you wear a mask for 10 days. And then if you're sick, isolate and consider getting tested. If you have symptoms that are COVID-like, you want to test to see whether you have COVID. And if you do have COVID, to isolate. So these are what the modified guidance, what changed in the new guidance. Previously, we have unvaccinated people were exposed, were asked to quarantine. Right now, the same guidance is for vaccinated as well as unvaccinated people. So there's no change as to, what to do. Those who are exposed do not have to quarantine. However, they're asked to mask for 10 days. On day 5, you can get tested if you have access to testing. And if after day 5, you still test negative, if you know that you've been exposed, you're asked to test again one or two more days to ensure that you're negative. Also, isolation if sick with symptoms, if you test and you're positive, you're asked to isolate for at least 5 days. If fever-free for at least 24 hours with symptoms improving, you can end isolation. But you're asked to wear a high-quality fitted mask until day 10. Avoid being around people who are at high risk of getting sick, and isolate for at least 10 days if you had moderate or severe illness or weakened immune system. For this group, you're asked to consult with your healthcare professional to determine when you'll be released from isolation. And finally, physical distancing. CDC didn't say that physical distancing is not a good thing, but it is one of the prevention measures that can be considered. As always, CDC recommends layered prevention. So physical distancing is one of those layered preventive measures. And then there's a new guidance for schools. So right now, CDC is not recommending cohorting students and screening testing. In the past, in the schools, students were screened to see whether they were positive. Quarantine, which was also removed from general, as well as test to stay. They're not recommending test to stay for schools. But they've added detailed guidance on when to mask in school and how to manage cases and exposures in schools, as well as how to manage outbreak in schools. The key here is layering, especially for students, 2 and under who are not allowed to wear masks, not recommended to wear masks. You want to look at ventilation, other preventive measures that will work in that respect. So at high COVID-19 community level, universal indoor masking is still recommended in K-12 schools and early childhood education programs. So just looking at where we are with our cases, you can see this was July, and we're trending down, even though you can see the tail is kind of leveling a little bit. I don't know if you can, I could see that on my computer. I don't know if you can see it here. So not dropping as fast as it did here. And this is the pie chart of variants circulating in King County for July. It's mostly BA5. The blue is BA4. When I was preparing these slides, in June, BA2 was the predominant strain. So how fast that has changed, and now we have mostly BA5. So I talked about home testing. So generally, what CDC is stressing is, individual responsibility right now is what we're looking at. What is your individual responsibility if you're a case or if you've been exposed? Testing is very critical. If you have COVID symptoms, you're asked to test immediately. If you're exposed to someone with a case, test after day 5. And if you test negative, test again in 1 to 2 days after your first test. If you're going to an indoor event or gathering, test immediately before you leave. And if your gathering includes individuals at risk of severe disease, you want to reconsider, make sure you test, and make sure that you're negative before you leave. So here, King County Health Department, we're distributing home test kits to King County residents. We have several thousands of cases of that, and we're going back to when the pandemic started with essential workers. We're looking at going back to those manufacturing plants and making it available to those essential workers. And, people can pick up, we're going to back to school fairs and things like that, where we'll see people. We want to make sure that the distribution is equitable. In addition to that, we're testing at the KimVax Hub, Mondays and Fridays, 9 a.m. to noon, Wednesdays, 1 p.m. to 4 p.m. And we're looking at another site in Aurora, hopefully coming soon. So vaccination, 68% of King County population has been vaccinated. About 54% have received their full vaccination with booster, up to date on their vaccination. And 5% for population 5 years plus, about 72%, down to 65 plus at 88.6%. So we have a new vaccine in the market. We have Novavx. This was FDA granted the emergency use authorization on July 13th, and ACIP also made recommendations for those 18 and over on July 19th. This is a 2-dose vaccine. The second dose to be given 3 weeks after the first dose. Currently, I believe we have limited supply, but available. So for information about vaccination, we still have kimvax.org. And I'll transfer right now to monkeypox. So around the country, we have 12,000 cases. In Illinois, 851. Here in King County, we have 8 cases. The age range is 16 to 44, mean age of 33. We have 7 male, 1 female, 5 in Aurora, 2 in Elgin, 1 in Carpentersville. By race ethnicity, we have 1 Asian, 2 Black, 4 Hispanic, and 1 white. I have other slides here, which I had presented at a meeting in June. I have them in here if anyone is interested that wants to. The information is still current, but I'm not going to go over them, the individual slides, but I'll take any questions.
Any questions for Ms. Unwuda?
Could you go back to the first summary slide on COVID, on the cases, hospitalizations, and so forth?
The summary slide.
It was the first slide in the.
Oh, sorry.
So I guess my question is that the community level is high, but is that based on the number of cases, or is that based on the number of inpatient beds used by COVID patients?
Right.
It still seems like it's gone up a little bit, but
yeah, so for a county to be at high community level, the number of cases more than 200, and the hospital admissions more than 10%, or staff inpatient beds more than 10%. So since we have more than 200 per 100,000, and we have 13.4 per 100,000 hospital admissions, that puts us in high.
Thank you.
Any other questions, Mr. Tepe?
Thank you, Tepe here. I still have that open question in my mind about, what's going to happen now that the schools are open. My feeling is that we're going to see an increase because the children are going to be able to start transmitting this to home and back and forth. So I guess you're prepared for all of that. I certainly hope, but let's hope those preparations aren't necessary.
Sure.
My other question is, you talked about the variant amount and the fact that 90 some odd % of it is BA5. Okay, how do you get those statistics? Since people are testing at home now, you don't get those tests. So where do those numbers come from that make up that that information for the pie chart?
Okay, so the variants, not all cases are tested for, genetically tested to determine what the variant is. For those who are tested, that's the proportion that we have
Yeah, but is that just for Kane County or is that
for Kane
countrywide?
County.
That's just for Kane County.
Mhm.
So
So it's a random sample. I believe 15%. I don't want to quote the wrong number, but a certain percentage of PCR tested samples are then sent up for sequencing.
Okay.
And those that are sequenced determine what their variant, whether it's a variant or not.
Okay.
And these are what we have.
then you said you had cases of test kits. How can people get those test kits?
They're available at the health department. We're going out to events in the area to distribute them, as well as reaching out to essential workers, because what we determined earlier in the pandemic is that those were less likely to have health insurance. And everybody who has health insurance should be able to get 4 cases. Each box has 2 tests, so 8 tests per month. If you go to Walgreens and you have your health insurance card, you should be able to get 4 boxes of Binax or iHealth.
So really, the kits that we have available through the health department are primarily for those that don't have health insurance. Is that correct?
We're required to distribute them equitably.
Okay,
Mhm.
yeah. Is there any way we can help or?
Sure. Have people reach out to us. We have a coordinator who is handling distribution, and we can get, we're reaching out to the manufacturing plants, wherever we feel that there's a need, for people who are less likely to have insurance, we're reaching out to them.
Thank
So
you.
in the communities, definitely.
Okay.
We could work with like ice cream truck companies and just have them, put a sign. Also, get your free test kit. Might help.
Yeah, that's a good plan. Yeah.
Any other questions for Ms.
Um,
Onoda?
Louis,
Oh, Louis, go ahead. And then Shepherd.
just a couple of thoughts. So like, do the VNA clinics have these test kits also?
Sorry?
Does the VNA clinic have the test kits also for distribution?
I don't know what the VNA has.
Okay,
We didn't distribute to VNA.
Okay,
I think they may have their own supply.
Yeah, they
Okay.
offer their own testing there.
okay. I was just curious because, at East Aurora High School, we have a VNA clinic on site, and I'm thinking, I hope they have them. I'll just double check there. Secondly, I think maybe tomorrow, Mr. Tepe, when we have the ROE there, we might want to ask them if they know. So I was thinking about in schools last year, they were making sure that, every evening they did a great cleanup, to stop the spread of COVID. And I think we want to make sure and remind them that they keep ahead of that cleanup. And also, I hope that we're still at the schools getting the message out that you can still get these vaccines.
Oh, yeah.
Yeah, we're really pushing vaccination
Mhm.
as, one of the most important preventive measure for COVID right now is to get people vaccinated.
Mhm. Yeah. Yeah, I did see one back to school fair where they said you could get COVID tested, and I thought that was really good to keep that reminder out there.
Sure.
We do continue to work closely with the schools. So we meet every month with school health personnel, and then we're in regular contact with the school superintendents. So this, even though they're looking very much to get things much more back to normal, this is still something that they're obviously paying very close attention to.
Now, for the home test kits, I believe there's a different supply for schools as well as long-term care facilities. So this is for the general public. There's millions of cases of home test kits being shipped to schools from the federal government, I believe.
And later this
Okay,
week,
good.
Go ahead.
we'll be receiving over 15,000 test kits for our long-term care facilities in Kane County, and we'll be distributing those to those long-term care facilities. So over 15,000 we have coming the end of this week to increase their supplies. We had already done one huge distribution, about 14,000 in April, and now we're resupplying them again.
Mr. Shepro?
Are the variants that we saw by community areas and underserved, is that starting to even out, or is that still a significant problem?
The variants.
The variant levels in different communities, are we still
So we
seeing?
had,
disparity?
some communities that didn't have access to tests or facilities that we had identified. I know Ms. Lewis had worked on some of those.
Mhm.
Is that starting to?
Yeah, that's our intent with equitable distribution, is to make sure that we're reaching those areas. Yeah, sorry, I thought you meant variant as in COVID variant. Mhm.
Any other questions? Mr.
Silva?
Kenyon. Silva, you're up after Mr. Kenyon.
Thank you. Excuse me if I missed this, but are we gonna see insurance companies saying you have to be vaccinated? Because even though you may get it, you get well quicker. It may keep you out of the hospital. That hasn't come yet.
I haven't heard about
I mean,
that.
if I was running an insurance company, I'd say, well, maybe I'd have a deductible. You'll pay the first $5,000. But if you're vaccinated, I'll pay everything. That would be one way to get people, maybe, I don't know, money always makes people step up.
Definitely.
That might be a question for Mr. Sturgis. He's our,
Oh, but you be there for the answer.
My guess would be is that they could offer you incentives, but I don't know that they could penalize you.
Why don't you could have a deductible? You don't get vaccinated, you'll pay the first $5,000. That's easy in the hospital. I know a
Time will
lot
tell.
of people that have had this and gone and they've been treated and they're all right, but I can say Public Works in South Elgin, they refuse to be vaccinated.
That's a question for Mr. Surgeons.
yeah, we'll bring him in next time and get some
Yeah, well,
answers.
And
vaccinated.
you'll have to listen to the answer.
What?
And you'll have
I
to
think
listen-
that's a question for a medical
Yes.
ethics individual, but I think there's a lot of medical ethics surrounding that question.
All right, Silva, you're up.
Thank you. Good morning. So I have two questions. One is surrounding the flu. Now that flu infection, we will be going into that season. Are we upping any efforts to not allow people to forget, or we don't want them to forget that the flu can also cause a lot of sickness and death. Do we have a plan in action for that? That's my first question.
Absolutely. You know, it's one of the things that we're working on right now is, you know, get the campaign out to remind people to get their flu shots. And, you know, that even with COVID, there's still, you know, we had at some point earlier in the year, we had an increase in activity, flu activity that was significant. So yeah, there's a chance that we could have high flu activity. It's starting in October is when our flu season starts. So yes.
Wonderful. I just don't want
Laura
COVID to.
you wanted to say something?
Yeah, I'm just what Uche had said. We definitely are ramping up that campaign. We typically want to get that kicked off in October. Our flu vaccines are starting to come in for our state and our county employees as we get those contracts completed. And we will still continue to give those at our immunization clinic to our uninsured or low-income families that are coming in there.
Thank you. My comment is that I want to make sure that that COVID doesn't overshadow flu, because both things can happen and both things can kill or affect different individuals. Combined, they could be even deadlier, but individually, they're both forces to be reckoned with. Thank you. And my second question is regarding monkeypox. The dreaded masks, would they theoretically help prevention of monkeypox?
So for monkeypox, person-to-person transmission, you know, by contact is the one that predominantly is the way of transmission right now. So I don't think, and I know that it was considered earlier, but I don't think CDC is going in the direction of asking people to wear masks for monkeypox. We're concentrating on avoiding contact, you know, skin-to-skin contact.
So air droplets are not a big form of transmission?
They can be, but right now, the most important thing is, you know, skin-to-skin contact. That's most of what we have right now is transmission by contact.
So,
And
go ahead, Silva.
And I thought I read somewhere that we had possibly the first case of animal or a pet, a dog, possibly in Illinois. I don't believe it was Kane, but of monkeypox infection.
I believe that was in France.
Wasn't that earlier today?
The first one we heard of was in France, and it was just released yesterday in the media, but I will look into seeing if Illinois had one, but not that I heard yet.
I must have caught the tail end of that, whatever I saw on TV or the article, but I don't remember where it was. I was just very concerned that it might have been Illinois. Thank you.
Hopefully the messaging doesn't become get rid of your pets, because that would be horrible. But it does sound like we don't need masks.
gosh,
We need
no.
hazmat suits instead. Is that probably more appropriate? Just cover the
hope
skin.
not.
Ms. Unwuta, can you go to that last slide regarding monkeypox that you showed, the one with all the information that So I would just have a request for your consideration with this, to remove that second to the last line, talking about men who have sex with men. This is something that was promoted a lot in relation to monkeypox early on. And it's very obvious that anyone can get it. It doesn't impact, just one type of lifestyle. I don't know if you have any comments on that, but it's just something I keep seeing repeated and it bugs me. That that community gets kind of targeted and in some cases even blamed for spreading a disease that anyone can spread and get.
Yeah, it's really unfortunate that people are focusing on that. Monkeypox has been around for several years, as you can see from this particular outbreak that is through Europe and USA started, the first few cases were among men who have sex with men. It doesn't mean that those are the only people who can get it. We do have one case that's female, and you can certainly get it from, other means. But the bulk of the cases we have right now with this spread in Europe and USA has been among men who have sex with men. It's certainly not the only way that you can get monkeypox.
Yeah, I would just ask that or at least consider that you remove that because it does seem to feed into some anti-gay hysteria that
The word
occurs in our
mostly
country.
also doesn't seem horribly scientific.
Yeah,
This is how
people
CDC.
miss that. Most people don't catch the mostly, they
Yeah.
just glob onto the others. So
That's how CDC has it. This information is from CDC, but I do recognize what you're saying. And, I will say on the record that it is not only among men who have sex with men.
thank you.
Mhm.
Any other questions or comments from Ms. Onwuta regarding COVID-19 or monkeypox? Hearing and seeing none, we will move on. We have no need for old business. I would ask for
Motion to
unanimous
place,
consent.
unanimous consent to place reports on file?
Shepro asked for unanimous consent, place reports on file. And I remember one meeting a couple years ago and Kenyon mistakenly said replace the reports on fire. And I thought that was also very appropriate motion to make. Yeah.
Burn them up.
As long as it complies with the Public Records Act.
Yeah, if we're in compliance, I'm good with that. Who doesn't love a good fire? The reports are on file. No need for executive session. We have no new business and it seemed appropriate to just tackle the budget presentations with the regular presentations. So I will ask for a motion and a second to adjourn.
I'll move to adjourn.
Shepro moves and Kenyon's
I am done.
stead.
Move to
Not used to that.
I can't, I'm not a member of the.
Mr. Tepe like to second or anybody like to second?
Strathman will second.
Strathman will second. Thank you.